Hello, my name's Bill Faubion and I'm a gastroenterologist at Mayo Clinic. I see both children and adults with inflammatory bowel disease, and I am going to visit with you briefly about a recent publication related to some excitement in stem cell therapy for Crohn's disease. So one thing we should know is that Crohn's disease many times can lead to penetrating complications around the bottom, so-called perianal fistulae. This can affect as many as 1 in 5 patients with Crohn's disease, and of those 1 in 5 that are affected, fully 2/3 may not respond well to what we consider our conventional therapies, which are currently available medications or even surgery for this problem. These types of devastating complications have led investigators to try to come up with novel ways to treat this type of complication. One of those novel ways that has been developing really over the last 3 to 5 years has been using something called stem cells to treat this condition. These stem cells are not the usual stem cells that one might read about in the paper, which can develop into any tissue in the body. These stem cells are actually derived from either patient's bone marrow or patient's fat. And in this particular article, these cells were derived from the patient's own fat. Those cells then are expanded, and these investigators used a surgical theater to inject the cells along the fistula's communication. And what this publication was about is the long-term follow-up of about 40 of those patients over 2 years. And what's exciting is that fully 7 to 8 in 10 of patients maintained a response and closure of these fistulous tracts over about 2 years. My own program is very interested in these cells, and we're also using stem cell therapy, but actually using a matrix to adhere the stem cells on to try to control this complication. So I think in the future you'll hear more about this potentially effective and seemingly safe therapy to treat this devastating complication.